body is free of malignant cells, the immune system is suppressed to prevent the rejection. They can actually, previous sort of patients are used via IV. So again, they want to really suppress the patient's own immune response before they give them the bone marrow transplant. Allogenic involves a donor. Autologous uses their own bone marrow. Now, again, people say, how can you do that? Sometimes what they will do, just to explain a little more, because people are like, how could you use their bone marrow? If this is not the optimal, obviously. You want to get a donor. But if you really can't find a donor, what they have done, and it is controversial, but it is something that they've done, for people who really are critical and they want to try it, is they treat and remove malignant cells from the person's own bone marrow, or they'll try to take an area that doesn't have those malignant cells there. They will use the person's own stem cell cord blood that's banked. In severe cases, it's not optimal again, but sometimes it might be something to hold them over until they can get the bone marrow. That would be best for them. Because people have asked, they said, oh, I read something about autologous in somebody that has cancer. How can that be? So that's why you might be reading that, those kind of things. And again, this kind of shows the whole process. What they're really doing is they're breaking down the bone marrow itself, and then they infuse it for the person. So that's what this whole little picture and slide show. And again, you don't need to know that whole process, but people sometimes don't understand how it works. They'll say, well, they take out this piece of bone marrow, but then they infuse it via IV. And it really has to do how they process it, and then yes, they do infuse the bone marrow IV. Go ahead.
Quick question.
Yes, here.
Blood donation, they won't take my blood, but they'll happily take my bone marrow. Why the difference? Surely there's a possibility of CJD in the bone marrow as well as my blood.
Jacobs, I know. That all came about too back in the 90s when it was such a big, mad cow was so big.
Yeah, they still won't take my blood now.
Yeah. No, I know. It's still, they put that into effect then, and it has remained in effect. But they do have that certain countries, for certain reasons, they won't take blood transplants. Bone marrow, though, which you're right, contains the blood in it, which could contain Creutzfeldt-Jacobs disease, which was that mad cow that was going around for a while in the 90s and even the early 2000s. It was a big deal in the OR. We had to do special sterilization of the instruments because it was a very virulent virus that could stay on through certain sterilization, especially if it was, because it attacks the nervous system. And so, like the brain, any brain surgery, any neurosurgery was like a big deal. But they've kept it in place, so I don't know that it's necessary, but it's there.
I would argue it's not necessary. We haven't had an outbreak in the UK since '97.
They are
exactly.
They still, you can't be homosexual and donate either.
Really?
If you've had a blood transfusion in France, you can't donate blood.
That's right. And that's old, because they didn't, they didn't as quickly screen, I guess, as we had been screening, but now that's even old.
Yeah, it still asks you on the screening if you're a woman, if you've had sex with a man, who's had sex with a man.
Really?
Yeah, it's still on there. Because I donate for
If there were a shortage,
There's a
they
whole
would
bunch of
change stuff. Obviously, there isn't a shortage, so right now,
There is a shortage.
There is, but I don't,
the shortage isn't that high that they're gonna change the law, then it's not that bad of a shortage. That's how law works. Like, if they're gonna change the law, the requirement has to be, like, more costly than changing the law itself. So, I mean, even if they say it's a shortage, they may just be saying that to get people out and donate blood, but, I mean, if they're really hurting for it, they would change stuff that is 40 years out of date.
Well, what I
New
will tell
Jersey
you-
has a shortage. New Jersey absolutely has.
what I will say,
huge
what Bill
shortage.
is saying, he's got a lot of truth in that, because what I would say is that we are very like knee-jerk, proactive. So when something comes out, even in other countries like a Creutzfeldt-Jacobs or like a mad cow with people, and they see this and they're like, okay, we're gonna do, they're very quick to put in place these kind of procedures, and then they're very slow to remove them. So then it becomes it's not as much of a priority to remove them as it is to put them in place. And again, to protect people ultimately, but then it does get belabored. Okay, so again, child receiving treatment, pain relief. The nadir point, remember their lowest defense, somewhere between 10 to 14 days after they get their chemo injection. So you want to watch for fatigue, prevent the bleeding, prevent skin breakdown, support and educate the family, because again, skin is fast-growing cells, so it can become very thin, break down very easily. Bone pain, you want to be able to treat that, which can be very common. Bone marrow suppression, again, you can see all these things we talked about. And again, that nadir point usually takes the bone marrow about 21 to 28 days to recover. But again, you want to really watch. They do have things that can help with the white blood cells, But again, and they can even give blood transfusions, which will help to kind of increase their immunity a little. But you do want to, again, keep that neutropenic diet. You know what I mean by that?
No fresh
No,
fruits.
No MMR, varicella, OPV, we talked about that stuff. Again, for at least 3 months after. And increased proteins, vitamin C. Kidneys can sometimes fail with this especially, so you want to watch that. Especially if it's septic, going to septic shock. Normal platelet count, 140 to 400, so again, you want to watch those. At 20,000, they're even at risk for intracranial hemorrhaging, bleeds anywhere. Especially the first areas to bleed are like the GI tract, so you want to look for melena. Am I saying that right? Secretory stool. Oral mucosa, you can actually see the gums bleeding very easily. And avoid skin punctures, meticulous mouth care, watch for trauma. Respiratory cardiac status, obviously clustering nursing care. Food high in iron is important, I list some right there. And anticipatory guidance, rotation caregivers, very stressful for parents too. And again, you want to watch for things like the nausea and vomiting, fast growing cells, mucosal ulcerations, alopecia, mood changes. And just some pictures. Usually they administer antiemetics prior to the chemo. Strict INO, small frequent feedings help, bland diets. Nothing that's going to irritate the mouth too much. And warn the children and parents that they do lose hair. Sometimes they can get the wigs prior to starting the chemotherapy. And hair really probably regrows within 3 to 6 months after the chemo.
So for
Good stop it.
us, we just need to